Metatarsalgia is pain in the ball of the foot by definition. And this is a very common condition that most people have experienced in some way at some point in their life. Metatarsalgia refers to symptoms that occur on the ball of the foot. So in this model, this would be kind of around the area at the base of the toes and usually occurs in the middle part of the foot. This can be associated with symptoms usually with walking or activity, usually does not cause pain when you are at rest or when you are sitting. And so if you have metatarsalgia, you'll notice that you'll prefer to wear shoes. When you're in bare feet, it becomes more symptomatic. And when you're walking in shoes, or at least stiffer shoes, it tends to be less painful. When it's painful, it's usually at the base of the toes. It feels sometimes like you have a wad of paper that's stuck underneath the toes, or your sock is wadded up. And it can also cause just simply pain, and you feel that you have to walk to the side or to the inside or outside of your foot to avoid pressure in the area. It is often associated with a callus. And if you have thickening of the skin underneath the ball of the foot, which would be kind of in this area here, then that also is an indication that you probably have metatarsalgia. Metatarsalgia can be confused with other conditions, both of these being, number one, a Morton's neuroma, which we've talked about in a different video, and it can also be confused with a metatarsal phalangeal synovitis, a big word, but really just meaning inflammation of the joint at the base of a toe. And metatarsalgia, when we refer to that term, metatarsalgia, we're referring more to a pressure problem that occurs because of the ball of the foot being too prominent or receiving too much pressure. It's often caused by metatarsal drop, where those middle metatarsals drop down a little bit further, and this occurs with age, and then becomes more of a prominent area to put pressure. And in most cases, the body usually wants to have pressure more at the first and the fifth metatarsals and not directly on one of the middle metatarsals. When the middle ones get pressure, they tend to have pain and they start causing calluses and other problems. If you have metatarsalgia, then you can treat this at home, and the first thing to do is to start wearing shoes, both outside and inside the house. And I usually recommend purchasing some type of a slip-on comfortable shoe for wearing around the house that you put on as soon as you come in the home. By doing so, it allows for pressure to be relieved and cushioned over a longer period of time, and often the swelling and the pain that has developed under the ball of the foot will disappear because of the treatment that you've been giving it by wearing a shoe around the house. In addition, you should choose shoes that have more cushioning in the ball of the foot and allow the metatarsal heads or the ball of the foot to be able to sink in and be a little bit cushioned, and in addition that aren't too flexible. So a little stiffer sole on the shoe will actually reduce the pain that you might have in your metatarsal head area. In addition, you can treat this with anti-inflammatories for soreness that comes on very rapidly and seems to be inflamed maybe after a hike or some type of sports activity. If you're not able to treat this well at home, then you need to see your foot doctor for this, and I would probably give it 6 weeks to 2 months, and then at that point consider this something that should be treated. When you see your doctor will usually get an x-ray of your foot to determine whether the length of your metatarsals is appropriate, and also to determine whether or not you've had a drop of the metatarsals or other deformities of the foot that might have led you to develop this pain. In addition, your doctor will often put a pad in your shoe behind the area that allows it to lift up so that you don't have pressure. Your doctor will then sometimes also use a custom orthotic, which is contoured to your foot to allow reduction of pressure. And if you have a hammer toe, he or she will show you how to tape the toe and to reduce pressure from it. Metatarsalgia can be effectively treated with non-operative treatments most of the time using these things that we've discussed. But in some instances, and I would estimate that being anywhere from 20 to 50% of the time, people do not get completely better with the use of these different types of pads and treatments. And in those cases, surgery is most appropriate. And surgery for this can be done in several ways. If your metatarsals are too long, your doctor may shorten the metatarsal with surgery, and that allows for less pressure in that area. If the metatarsal is dropped, your doctor may do a cut in the bone back further in the foot and lift up the metatarsal to reduce the pressure from it. If it's just simply because the metatarsal head has a spur or is too prominent on the bottom, you may have a surgery where the doctor will shave off the bottom of that metatarsal head and reduce pressure from that. In addition, he or she may also correct a hammer toe or a toe deformity that's causing the problem. It's very important that the diagnosis be made before any surgery is recommended, because if this is confused with a Morton's neuroma, for example, the appropriate surgical treatment may not be administered if the diagnosis isn't correct. So you should be aware of these other diagnoses and make sure that that diagnosis is made properly.